Welcome to Health Beyond Prescriptions. I'm Dr. Sowmya. Today we are talking about a simple but powerful tool that can completely change how you understand your health, the symptom diary. Many people feel confused by their symptoms. Headaches come and go, digestion feels unpredictable, and energy fluctuates. It often feels random, but usually your body is responding to patterns. You haven't noticed it yet. It doesn't cost money, it doesn't require an app, and it often gives more clarity than multiple tests, and it's called a symptom diary. So, what is a symptom diary? It is simply a way to write down what you experience in your body along with what's happening in your daily life. It turns vague symptoms into useful information. Not just today I had a headache, but when it started, what you ate, how you slept, how stressed you felt, what made it worse. It turns vague symptoms into useful information. And most importantly, it shifts you from feeling confused to feeling curious and empowered. Why we miss patterns? Our brains aren't designed to track subtle patterns over days or weeks. A diary becomes your external memory, helping you see connections between food, habits, stress, and symptoms. Here is something I tell my patients often: symptoms rarely appear out of nowhere. They are usually influenced by food, sleep, stress, hormones, movement, environment, and habits. But our brains are not designed to remember patterns over weeks. A symptom diary becomes your external memory, quietly revealing connections you would otherwise miss. This is not about obsessing or tracking every detail. It's about choosing a few meaningful things that strongly influence symptoms and health. Excuse me. Start by tracking pain or discomfort, such as headaches, abdominal pain, joint pain, or chest discomfort. Note when it starts, how strong it is, how long it lasts, and what helps or worsens it. Food is one of the common symptom triggers. Write down what you eat, when you eat, caffeine or alcohol intake, and how large your meal was or how late it was. Patterns often become clear over time. Over time, patterns may emerge. Headaches after certain foods, bloating after dairy or gluten, fatigue after heavy meals, heartburn after late dinners. For headaches and migraines, diaries often reveal triggers like skipped meals, dehydration, caffeine changes, poor sleep, or stress. How about bowel movements? Track their frequency, consistency, pain, urgency, or changes from your normal. Consistency meaning whether it was watery, solid, semi solid. Urgency meaning you feel like you have to go and nothing comes out. Your gut often reflects stress, food intolerance, and hormonal changes and inflammation. This is especially helpful for IBS, irritable bowel syndrome, constipation, reflux, and bloating. Now, sleep is very important. It affects everything. Note your bedtime and wake up time, the quality of your sleep, how frequently you're waking up at night, and do you feel rested when you wake up? Poor sleep often worsens your pain, digestion, mood, and energy. Stress doesn't stay in the mind. Track the stress levels, triggers, big life events. It often shows up as headache, gut symptoms, flares, or fatigue. This is biology and not just your imagination. Track your movement, screen time, your posture, your travel, menstrual cycles if relevant, and any medication or supplements that you're on. How does this help your doctor? Better data, better care. It helps doctors see patterns, avoid unnecessary tests, give you a personalized treatment instead of guessing. Instead of saying, I don't know, it just happens sometimes, you can say, I notice my headaches occur 2 days after poor sleep and high caffeine intake. That changes the entire conversation. How this helps you, you learn which foods to avoid, which habits worsen your symptoms, and what helps you feel better. This builds confidence and reduces fear. You stop asking, what's wrong with me, and start asking, what is my body responding to? That shift alone is healing. A symptom diary is not an obsession, it is not overdiagnosis or self diagnosis. It's about curiosity, awareness, and partnership with yourself and your healthcare team. It can be simple. You can use a notebook, a notes app, or a simple table. Track just for 7 to 14 days. That's often enough to see meaningful patterns. Each day, jot down your main symptoms, your food intake, the sleep, the stress level, and anything unusual. Symptoms are messages, they are not enemies. Your body is constantly communicating. A symptom diary teaches you how to listen. It doesn't replace doctors or medications, but it complements them. A symptom diary teaches you how to listen without fear. It helps your care become more personalized, more precise, and more humane. This is exactly what Health Beyond Prescriptions is about. Going beyond quick fixes and tuning into the wisdom of your own body. If this episode resonates with you, please do share it. Until next time, be curious, be gentle, and listen closely to what your body is saying. Health Beyond Prescription honors medical science while also exploring lifestyle, habits, emotions, and meaning. Thank you for being here. Be curious, be gentle, and listen closely to what your body is telling you. I'll see you next time.